Hello, my name is Imad Saloom. I'm an oral maxillofacial surgeon. I'm the chief surgeon and general supervisor of Saloom Dental Clinic, located in Tartus, Syria. It's a great pleasure for me to be with you today on dentinal tubules. My topic will be about managing the risks and complications in the anterior mandible implant therapy. The anterior mandible had been advocated as the site of choice for implant placement. It has the best bone quality, even in atrophied mandible. We get the highest success rates of placing implants in this region, and it's suitable for multiple prosthetic options, either for partial or full edentulosum, for fixed or removable overdentures. It has easy surgical access, and it's far away from important vital anatomic structures. That's why the anterior mandible is generally considered a rather safe surgical area and the ideal site for implant placement. However, during the last 2 decades, several papers have been published where their authors describe a near-fatal airway obstruction after routine implant placement. One of the early papers was published in 2001, where Joseph Nimatso described the case of a severe hemorrhage and a severe edema in the sublingual space that led to a swollen tongue that obstructed the oropharynx with a full airway obstruction. The patient was hospitalized in a near-fatal condition. Timothy I. Saxon, in 2004, also reported a case where he got rapidly progressive elevation of the floor of the mouth with a sublingual hematoma, and the swelling appeared to have crossed the midline. Al-Bustani and his co-workers, in a publication in 2006 on the same subject, stated that the anatomy of the inferior region of the anterior mandible makes it vulnerable to perforation, especially in cases of severe atrophy or in cases when we use increased length of dental implants. And he stated that this is really an uncommon complication, but it's potentially life-threatening. Other cases also have been reported during other dentoalveolar procedures. Manzikos reported a case during removal of a torus mandibularis case. Reviewing the literature may show us dozens of published papers and cases reported during the last 2 decades. Those cases had triggered the alarm for enhancing a new review of anatomic variations related to implant dentistry and for a new assessment of the blood supply to the mental region. Vivitz and his co-workers, in their study published in 1997, he stated that the lingual artery and the hypoglossus nerve were more inferiorly located than were classically described in the anatomy textbooks, where he found that the most injured vessels in this area were found superior to the mylohyoid muscle in a distance about 14.5 millimeters in a medial vertical direction in the canine area. That's why he stated that the submental artery can be considered the main arterial blood supply to the floor of the mouth and the mandibular anterior area and the lingual gingiva. Hofschneider from Vienna, in an assessment of the blood supply to the mental region, he stated that the submental artery